So continuation with the National AIDS Control Program. So another interventions coming under this Nacp 4 are integration of HIV services with health system. So now in all the healthcare centers we do have implementation of this HIV services. So this HIV services are being integrated in as normal general health services. So it is not a separate wing, it is now integrated, and same like any other diseases, HIV is also considered and it is being treated. Effective use of strategic information at various levels, that is state, central and departmental level. So all the levels the strategic informations are being provided, and effective implementation of this program at all the levels. So that is about National AIDS Control Program. Coming to the role of nurse in this program, as she is educating the public on mode of transmission, prevention and control of the disease, so that it helps the public to come out of the stigma. So stigma is a major issue seen with this HIV. Now as compared to a previous era, we don't have that much of stigma issues. Public are more aware and they are with wide-mindedly accepting the disease, and there is discrimination and stigma against this AIDS are being very less compared to previous era. Identify the local social welfare agencies from where the people can get help like financial aid, schooling support, supply of drugs, food grains, help for getting the job. So for all these local self-government NGOs are helping the AIDS victims and AIDS victims family because they might have lost their job because of their health facilities or health issues. They may not be able to go on with the regular pattern of schooling or all those things. So financial aid, schooling support and drugs, food supply and help for getting job, all is needed. So for all that, local social welfare agencies and other various national and international NGOs, local NGOs are also helping the AIDS victims and their families. Participation in survey to identify the problem depth. So there are different, mainly we are using the snowball sampling method. You might have learned this in your third year. Snowball sampling method. So that is the main method we are using to survey and identify the HIV cases and their families. And this is how the survey is being done, and identifying the problem depth and how much of prevalence is there in the about the disease in specific areas. Educating about following aspect, that is lifestyle modification, positive living, measures to avoid infection, early identification of opportunistic infections, ART importance, sex education, STDs, family planning usage, participation in screening of high-risk cases, treatment and follow-up. So all these aspects health education is being provided. Strict vigilance on proper sterilization of the instruments, because from that also a lot of patients are getting, they seems to be very innocent, but they are getting landed up with HIV only because of the unsterilized or septic instruments that is used in the hospital. So strict vigilance is needed that the instruments that is used for in the hospitals has to be sterilized, autoclaved well to prevent transmission of infection from person to person. Awareness about opportunistic infections. AIDS patients should not be discriminated as it is not a contagious disease. So all these aspect awareness is being made. So because of this the cases are very less, and nurses and all other paramedical staff are also working together for the implementation of this program. Thereby we find a good success in reduction of cases regarding regarding AIDS. I hope it is clear for you. Thank you.